Mark, like most of us, you wear multiple hats at any one time, so comment, if you would, with your AACU hat as well as your clinician's hat, and also obviously a key part of a large urology group.
Well, I disagree with Dr. Crawford. I don't think they got it right. I think that, that they went overboard. And I think that the criticisms, and I think most of the urologists in this country feel that they overstepped their bounds a little bit, and that they didn't listen very well to some of the expert opinion during the advisory period of time here, particularly from the AUA and experts in the prostate cancer, that were able to break down some of the studies that they reviewed. They only had 2 studies, I think, that they used primarily. The follow-up was short. The PSA case finding in the control group, I mean, these were all complaints about the 2 studies. I think that the task force had a chance to go back and revise that some and didn't. And I think most people feel that they plowed ahead without really good data, or at least they looked at the data incorrectly. I think I would agree with David that we probably do diagnose too many men with prostate cancer, and some are overtreated, but we can't ignore the fact that the death rate from prostate cancer has substantially declined since the era of PSA. I mean, I think that's a truth. And we also can't deny the fact that many men suffer from prostate cancer for many, many years before they die from it. So death from prostate cancer as an endpoint is probably not very good. I think that the Blackburn legislation, number 5998, that's come out and being supported by the AACU and the AUA and LUGPA, I think is good. So I do think that the Transparency and Accountability Act is probably a good thing. We do need more insight from and opinion from the experts who are involved with treating prostate cancer patients. As we know, there were no oncologists or urologists on the panel. True that they may have some biases, but there are a great number of good researchers in urology in this country who can give a good, unbiased professional opinion about this. And the last thing I would say is there are men. I've seen men in my practice, and I know that there are other men throughout the country who are not coming in, who are confused by this. And I think it's going to be our role to come out and come up with a little bit more balanced assessment of how prostate cancer screening or case finding should be done. I don't think that we should turn our back on it.
I didn't say that I thought they were totally right. I said that, you know, there's some truth in what they said, and we need to listen to it and try to find some common ground. And, you know, it should be an eye-opener. They did have an open period where people could respond. I'm actually in favor of screening. I responded in a very concise way, and a lot of people did. And maybe they didn't listen to it, but, you know, that kind of group has, you know, the only parallel is they came out against screening about breast cancer, and they got buried on that, and they changed their mind. So, you know, maybe they will fine-tune this in the future.
I think you're right, though, David. I think the egregious thing about this is that they tied over-treatment and early diagnosis, and they're 2 separate entities. And just because just because there is recognized over-treatment, it doesn't mean that the patient doesn't have the right to know they have prostate cancer at a very early stage. So
that's what we've been saying in Prostate Cancer Awareness Week for 2 decades. Know to choose, you know what you have so you can choose the kind of treatment, and it may be doing nothing. But the unfortunate thing is, a lot of times when men are diagnosed, the train has left the station, and they come to see us, and you know, we give a lot of lip service to active surveillance, but if you look at the numbers of men that actually go in active surveillance, it's way less than 10%, and it's decreasing rather than increasing.